A very warm welcome to everyone joining us today. Good afternoon. I'm Shakunarang, member of G100 Australia Inspire Sphere and founder of Bird Migrant Onboarding and Integration Services, where we partner with individuals in their career growth through world class coaching and skill certifications. It is my immense honor to host this meaningful conversation today on Nourish, Heal, and Thrive, a holistic 360-degree approach to women's health, safety, and well being. Today, we gather across Australia, India, and the UAE to learn, reflect, and empower one another. This initiative is proudly brought to you by Wiki NRI Council, G100 Australia Inspire Sphere, and Wiki Southern Australia, organizations committed to uplifting women globally. Before we begin, I want to acknowledge the incredible leadership that guides our work. I would like to introduce Dr. Anar Mehta, President of the Wiki NRI Council. She is a global advocate for women's empowerment. Her leadership connects women across borders, building platforms for safety, dignity, and growth. Her vision inspires every initiative we undertake. Achla Bhupendra, Vice President of the Wiki NRI Council, is a strong pillar of support for women's leadership and community development. Her dedication to strengthening women's voices globally continues to guide our mission. And our next dignitary is Ms. Shireen Lakhani, G100 Australia Chair, President of Wiki Southern Australia, and Joint Secretary of the Wiki NRI Council. She is a serial entrepreneur, best selling author, and a powerful advocate for women's empowerment across the borders. Her work brings together leadership, wellness, and community upliftment, making her a driving force behind today's event. Shireen, over to you, please.
Thank you, Shakun, for a warm welcome. Welcome, everyone, and thanks for joining us today. I'm Shireen Lakhani, G100 Australian Chair, President Wiki Southern Australia, and Joint Secretary Wiki NRI Council. It's my privilege to represent two powerful platforms, Wiki and G100, both dedicated to uplifting women's voices, well being, and leadership across the world. Our vision is simple to create safe, supportive, and empowering ecosystems where women thrive, personally, professionally, and emotionally. Wiki and G100 believe in collective strength, sisterhood, and global collaboration. Today's session reflects that mission. We are here to talk about women's health in a holistic way: the body, the mind, safety, and inner balance. Each speaker today brings expertise that touches a different dimension of women's life. So let's open our hearts, learn, and grow together, and be here today and follow this journey with all our sisters. Thank you so much, everyone, and back to Shakun.
Thank you, Shireen, for setting the perfect tone for today's session. And now joining us is Mrs. Ritika Mehta, Vice President of Wiki Southern Australia. She is a dynamic leader committed to strengthening women's voices, building community connections, and creating meaningful opportunities for women across the region. Her clarity, compassion, and leadership continue to shape the Southern Australia chapter. And apart from that, we are also very proud of Ms. Shafali Garg, General Secretary of the Wiki NRI Council. With over a decade of experience in regulatory services, she has also led teams in HR, mentoring, soft skills training, and image grooming. Her diverse expertise and leadership make her an invaluable pillar of the NRI Council. Shafali?
Thank you, Shakunji. That's a wonderful introduction. Thank you so much. So, hello everyone. Yes, as Shakunji explained already, that why we all are here. I'm Shifali Garg, General Secretary of Wiki NRI Council. Our vision is to build a strong, supportive community where women feel seen, heard, and empowered. So, Wiki NRI Council, what it does? So, we focus on creating opportunities for women to grow through leadership, wellness, education, and collaboration. So, today's topic is really close to her heart because women health is a foundation of women empowerment. When women are healthy mentally, physically, emotionally, they lead stronger families, stronger communities, and stronger nations. Today's speakers will help us in understanding health from every angle. So thank you, Shakunji. Over to you. Thanks a lot.
Thank you, Shefali ji, for your heartfelt message. Really heartwarming. And let's get to the panel discussion now. And let me introduce you to the speaker, the first speaker for today, Dr. Anush Gasparian. Our next speaker is Global Chair of the G100 Anti-Gender Based Violence Wing, President of the India-Armenia Business Council, and co-founder of the Romana Center for Women's Rights and Leadership. She's an international legal researcher and women's rights advocate with a PhD in law, specializing in workplace gender equality and prevention of harassment. Dr. Anush, the mic is yours.
Thank you very much for your wonderful introduction, and thanks for the organizers of this great event. The topic is very much important because we cannot lead, we cannot survive, we cannot go ahead until unless we do not realize the importance of nurturing our health. While just reflecting to the health, the first thing we think is just like, okay, the medical doctors visiting and observing our well-being. However, it has deeper roots than just your visit to the doctor, to the hospital, or to some clinic. We should reflect to the realities that draw us back. As someone with a background on the women's rights and as well as working decades against harassment, workplace harassment, violence against women, I would just like to keep it very brief and just gain your attention to the important aspects that after this project you'll be able to carry on and for yourselves, for ourselves, all of us, and as well as in our communities to make that difference. There cannot be possibility of giving the best until unless we do not realize the importance of awareness of self-discrimination, awareness about what is the violence when it comes to the private and the public. To keep it very brief, it has different forms. It can be in a form of physical, mental abuse, financial abuse. It can be in form of domestic and the public spheres where it comes to the sexual harassment at workplace, when it comes about the domestic violence at the house level. And sometimes it's not also only about someone committing wrong against someone, but it's also about ourselves letting wrong to happen continuously to us as a female by ignoring our biological differences, like the maternity, like the child care, like the period of the periods of the menstruation and menopause and etc etc. So this is a great platform that you will be able to reflect all the aspects, but I just want to tell you one important thing. As you all are representing a community away from the homeland, I want to just highlight one of our projects which we are running is about the help, the campaign for our diaspora members, the females, where we just touch upon different topics by saying that your travels, your rights travel with you. Despite of the place that you are, you should remember one important thing. Every country has different laws. However, there are certain laws which travel with you wherever you go. Those are human rights. Those are universal rights. You have the right to life. Remember always, you have to right to live with dignity. By saying right to live with dignity, we reflect to many aspects. That means nobody can make you feel bad mentally, physically, at any aspect of your life, whether that is private or that is public. And whether you are facing anywhere any sort of discomfort, I'm not going to the extreme cases, you remember that being away from the homeland is not a limitation to your human rights. Always be aware of getting attached to the community, like right now, what our esteemed organizer is doing for all of you. To the community first. Second, remember that there are always support centers for the females all around the globe. You can just try to find out the local organizations, non-government organizations, which are dealing for the women's rights in the particular sector that you are facing the difficulties. But amongst and above everything, just pay attention to the basic fact that you should make sure that your documentations are safe enough. First thing, that wherever you are, you have to make sure that you have the support group inside that country as well as outside, maybe in your home country or another country where you feel the people are supportive to you and are to be trusted. By saying wherever you travel to any certain country, first of all, you have to make sure that you send your documentations, like the ones that are most important for your identity identification, to the respective embassies of your countries, by just making sure that they are safe enough and that that particular country is your representative and they are aware of your presence in that particular country, and in case of emergencies, any sort of emergencies, you will not be able to remain without an identity. They will be able to identify you through your documentations that are already available there. Next, there is a kit of survival types when it comes to the domestic violence, when it comes to the workplace harassment, etc., etc. I do not want to extend this topic beyond the requirement. However, I just want to make sure that all of you realize that, think about it, reflect on, just sometimes just sit and think about it, observe as a female what it is that you really want to have in order to feel yourself self-sufficient, happy, healthy, and enough for yourself, for your family members, and independent, of course. So, and then identify what are those things that are stopping you from that. Never make the distance from your support system, geographical distance, or any sort of distance, maybe you are isolated for some reasons, make you feel a victim of the situation and to give up on your basic human rights. You have a right to live. You have a right to live with dignity. And despite wherever you are in the world, that right is traveling with you. And there is a huge system which can work for helping you with that. Those are the community members. Those are the organizations, government and non-governmental. That can be also a media. So you please be strong for yourself in order to be able to help others to stand up for themselves. And of course, as a female, we have to be strong in order to be a role model for our children as well. And not only to our children, and for those who do not have children, for the community members, for themselves, for everyone. So thank you very much for this opportunity. And of course, you can anytime reach us out for more with regards to this. Thank you very much.
Thank you so much, Dr. Anush. Really, really great insights. And I totally agree that support systems matter in such situations, and silence is never the answer. Okay, and while we are at it, I would like to invite Dr. Jyoti Mary, a highly respected obstetrician and gynecologist in Western Sydney. She has held key academic roles with RANSCOG, UNSW, and other professional bodies. She is also the founder of the Dharma Community of Australia, leading initiatives that improve health outcomes and raise awareness. Dr. Jyoti, the stage is yours.
Thank you so much. Thanks for the kind invitation and introduction. Um, I've been doing the health talks for so many years in various community groups, but this is the first time I'm combining this kind of thing. When Sherin asked me to do something with pregnancy and cancer, I thought how the talk would go, but actually it is very important and very much needed at this stage. There are quite a few women or the families with women who have been diagnosed with cancer. They are so uncertain about what's happening, what is going to happen. I'm just going to cover briefly about each one. We all know that what is cancer. Cancer is something, it's an abnormal growth of the cells, which could spread into the adjacent structures or over the body. And that's what we call metastasis. And that's the one, once it comes to that stage, that is what is responsible for death and everything. So cancer is something which is not very pleasant, and it's still one of the leading causes in the world. And the cancer, if you have to look at the top 5 ones, lung cancer is leading at the moment. Lung cancer has come up. In the past, it used to be a breast cancer. So now it would be lung cancer would be the first one, followed by breast cancer, colorectal, prostate, stomach, and followed by the remainder ones. So we'll be focusing on women's health only. So I'm not going into the prostate or any of that. So what is this cancer? How can we stop it happening? Can we do? Actually, no, it can happen in any part of the body, as I mentioned before. We can't keep screening or keep guessing what it is. However, based on the research and resources we have at the moment in Australia and most of the countries, we have a very effective screening for certain cancers only. What is a screening test? Screening test is something which can be done on everyone without symptoms, just like me and whoever is hearing here. We don't have any symptoms. We are all fine, but we are the ones needing the screening test. It is going to pick up and suspect if there is any suspicion or if anything there, it's going to tell us that, look, you are at a higher risk, you better get checked. It's not a diagnostic test, it's a screening only. Based on that test, we would go further to do more diagnostic investigations. Let's talk about the ones what we have. We do have cervical cancer screening in Australia, bowel cancer, breast cancer, prostate cancer, and recently lung cancer one screening is also available. Now, bowel cancer is between the ages of 50 and 74. The government sends a kit to every 2 years to our, to the person's residence based on their age group, and they can do it their own convenient and give it to the lab. If that's abnormal, they go further for colonoscopy and for the biopsies and other things. Now, cervical cancer. Cervical cancer is done between 25 and 74 years of age here. This could vary between different countries. I understand. I was talking to one of my friends the other day, and she said in India, they still do the pap smear, which is a cell-based testing. That's totally fine based on the resource. And some other countries, they do a different testing. What we do is, based on the evidence, we do test the virus called HPV. Based on that virus, positive or negative, what kind of virus we have, because there are different types in that HPV virus family. Based on what we have, your risk goes up. Certain types of virus in that family would put your risk higher up. That's when we go for a slightly different screening, which is testing the cells. If that's abnormal, then you go for a proper testing under the microscope and taking some biopsies. And now recently, over the past few years, we have introduced self-collect one, which means women can do a swab. They can collect from the GP, go and do in their own house, 20 to 30 seconds, just a little swab stick, very fine one. I'll show you actually. I'm in the rooms today. This is how it looks. Just introduce into the vagina and do it for 20 seconds and put it and drop it off at the lab. So there is no inconvenience or, privacy issue or anything. In the past, the women always are scared to go to the doctor to get that speculum and having intrusive testing. So that's a good one. And the next is a lung cancer. It's only for eligible based on the risk assessment. They have got that screening one. Prostate cancer, whoever wants, they could get it done. Breast cancer, we did talk every 2 years between 50 and 74. Now, once someone is diagnosed with cancer, it's nothing to do with the pregnancy. Someone has been diagnosed and treated and everything done. Now, can they fall pregnant? Yes, they can. They can. Depends on what's their age, at what stage they were diagnosed, and what is their age now, what kind of treatment they have. Certain kind of cancers needed a radical surgery. That means a major surgery being done, uterus taken out, for example. They cannot. Their option would be surrogacy. But other cancers, and if they have extensive radiation to the internal organ and pelvic organ, probably they may not be suitable. So it all depends on what kind of cancer, what kind of treatment they had. So it is very important for everyone to have proper counseling before getting the cancer treatment and also after that. Nowadays, unfortunately, the child cancer doesn't spare any age group. It affects children also. So when the children are treated, by the time they come to the fertile age to have a family, that's when the problem would be. So there are some fertility conservation methods like freezing the eggs, freezing ovarian tissue, or freezing the embryos if they're already having a family with a husband or partner. So these are the ones, quite a few patients, when they get a cancer, they're not aware, especially some parts of the world. It is a bit hard for them to understand, but it is important to inform them. What is a good time to fall pregnant after the cancer treatment? Once it's been cleared, in remission, no relapse, best to give 2 years. That's the recommended one. However, if it's all negative, scans are all clear, by accident, if they fall pregnant, no need to terminate. Based on how things go, we could do it. This is one kind of one. And the other questions what women will ask is, if I fall pregnant, would my child get it, the similar cancer? No, it's not like that, unless it's a hereditary one, like a bowel cancer and breast cancer with BRCA1 and 2 gene mutations. Sure, they have got a 50% chance of giving it to their offspring, their child. So they could choose the option of getting a pre-genetic testing, embryo tested before the implantation. That option is available. So that means they have to see the IVF specialist and see one of us and then get it discussed. What they do next? They will be monitored based on how it is. Whoever had a radiation treatment to the pelvic area, their pregnancy is not going to be smooth. There is a higher risk of miscarriages, higher risk of premature labor, higher risk of growth restriction for the baby. That means baby would struggle to grow. And also a risk of mom getting complications like a preeclampsia, which is a blood pressure related condition in pregnancy. That's how it goes. So it is important. But of course, there are other fertility options available. As I said, they can get a donor egg, they can get a donor sperm if it's a male person, donor embryos are available, and also they can go for a surrogacy or adoption. These would be the options for them. This is one group. Next, let's talk about the new diagnosis of cancer in pregnancy. Does pregnancy put you at risk of having cancers? Not really, no. Purely pregnancy-related cancer is called choriocarcinoma. That is related to one of the placenta becoming like a malignant, cancerous, abnormal cells. That's a different one. But rest of the cancers is exactly the same as non-pregnant. If you have any symptom, you have to get it checked. You should not ignore. If you are having abnormal bleeding, don't think that it's a pregnancy having a bit of spotting. Just talk to the doctor. If you're having a bit of lump in the neck or a throat, it could be related to thyroid or it could be related to lymphoma. So you should, if anything is not going away in a couple of days or a week, usually people check for 1 or 2 weeks, always talk to your health professional. And the other cancer, same as this breast cancer. Breast cancer is the cancers in pregnancy, it's diagnosed in the range of 1 in 1,000. That's the incidence. So it's not a common thing. However, still happens. If you notice any lump in the breast, don't assume that it's in the pregnancy change. Pregnancy does lots of changes your body. You do get different kind of blood circulation and everything, you do get lumps and bumps here and there. Your skin changes, your moles, there is an increased risk of warts, and people, if they have moles on the face, they do get discoloration, over pigmentation and all that. However, if any mole you have anywhere in your body, and if it's spreading, or if you are getting something unusual, irregular borders, go and see. It could be a skin cancer, melanoma, or other kind of skin cancer. Breast, if there is a lump, get it checked up. Simple. What kind of test you could do in pregnancy to screen for cancer? You can safely have a cervical screening. Nothing wrong. It doesn't do any harm to the baby or the pregnancy. So you could do that. And the second one you could do is for breast cancer, you could have ultrasounds, and mammogram is pretty much fine. If anyone is needing an X-ray in early pregnancy, we do with, or a later pregnancy, we do with abdominal shield, so that that not much radiation to the fetus, to the baby in the tummy. And the other one, MRI is good. Only thing, if you are going for the PET scan or something with a more radiation, we only have to do if it's really needed. Otherwise, we don't do it. But however, mom's life is a priority. So we just need to have a look into that. Biopsies, needle aspiration, ultrasound guided biopsy, they're all pretty safe. They wouldn't do anything. So do not hesitate. If you have any symptoms abnormal, go and get it checked. You might have your obstetrician or your GP or whomever you have. And the next one you would be thinking of is trauma. Emotionally, women will be devastated before the pregnancy diagnosis or after. It's always important to reassure them and give a proper, appropriate counseling. It's not just the physical well-being. Emotional well-being is very important. Always you need to have a multidisciplinary approach. Make sure you get a social worker involved, a psychologist, if needed, a psychiatric input as well, and your cancer treatment doctor, your obstetrician, and your family doctor. It's a group of people. And always in the family, there'll be lots of family disturbances too, between wife and husband, between children. So we have to make sure that aspect is also looked into. And I'll just give you a brief overview of the treatment. Normally, whenever someone is diagnosed with cancer, the treatment would be either surgery or chemotherapy or radiation. In pregnancy, chemotherapy is okay, depending on what it is, and radiation we avoid. But first trimester, we try to avoid any treatment, any of the chemo radiation. Certain kind of medications could be given later part of the pregnancy. Again, it totally depends. Once we reach say, if mom needs some extensive treatment, and if she's still pregnant, we wait until the baby comes to a safe zone without compromising mom's health, where we could, where baby's survival and the well-being will be okay, and we could deliver and monitor the baby at the same time. We could treat mom, because we have got no hurdle to for obstruction for the treatment. That's how it goes. In general, so that is about the pregnancy. In general, the population is more aging population in the world. Our life expectancy is increasing. So I'm just giving an Australian one. 1 in 2 Australians by the age of 85 would have some kind of cancer. But the survival rate is much higher compared to the past. The reason is we have more screening tools for the common cancers, and it is acceptable treatment, and we are all happy. There is also palliative care for people who are unfortunately diagnosed with very at a late stage. The palliative care is mainly to give them comfort, improve the quality of life, and just keep them a bit comfortable with no pain and food and looking after them. And most of the palliative care patients, nearly 90% of them, would be with advanced cancer. I think that does cover up with the time I have. Thank you so much, and hope you have got a little bit of understanding. And if you have any questions to ask, or if you need more information, I'm available through the group. Thank you so much.
Thank you, Dr. Jyoti. This was indeed very, very insightful sharing, and I'm sure a lot of audience will really get benefited from the various um, you know, information that you have shared with us today. And indeed, early screening and informed care definitely save lives. Okay, our next speaker, I'm very delighted to welcome Diya Dhar Mishra of Skillwell Academy. She's a mental wellness and career readiness academy coach. She is an MBA qualified career readiness coach and mental health counselor who has trained over 500 young professionals across India, helping them become job ready, confident, and emotionally resilient. Diya, we are all ears for your thoughts.
First of all, thank you very much, Shakun, for this wonderful introduction. And most importantly, I think just to check whether I'm audible visible. Am I audible
Yeah,
visible?
totally.
Okay. So I think, first of all, I'm really honored and I'm truly, truly very, very happy that I'm invited in this particular platform to speak on a very important topic, mental health. I was having a script with me to say what I wanted to say, but I think, hearing to all these esteemed speakers here, I think I'll just say everything heart to heart. First of all, it was very informed. It was a very informed thing that we all are present here and to listen to Dr. Jyoti, what she was saying, that during pregnancy, people planning for pregnancy, I think one of the most important things that we are having, one of the most important um, I should not call it disease, but I think one of the most important fearful word that we have is cancer. And she spoke about that itself. And I think another most important thing is what we have is mental health, right? So I think the first time when we are born through our mothers, and the mother is a woman, right? So when we are talking about mental health, how can we forget her? She taught us to breathe, she has given us life. And the only one thing that I think of women's mental health is the word sacrifice. Each and every woman, there is one thread that I think that has attached to uh, that has attached all of us, is nothing but mental health. That is nothing but sacrifice. That is nothing but not speaking for ourselves. That is nothing but, you know not prioritizing ourselves. And I'm really happy to see, whenever we scroll reels today, and I'm really happy to see people are, women especially, they are, prioritizing their mental health. Now the mental health awareness has become much more larger at end, and people are getting aware, people are being more vocal, more and more vocal about mental health. I have a lot of clients where, I just do nothing but give them ears, just ears to what they want to say, just ears to what they feel. Usually when I counsel people, so I'm a career readiness coach, as Shakun said. So I usually see the mental health side of students, and I usually do a lot of sessions on self defense because I'm a black belt in karate. And I do a lot of sessions on self defense. And for Vicky also, I have done a lot of sessions for WICCI for different chapters. And I would be, at end, I would be very much happy to do a session on self defense also. But I think the word self defense also brings a brighter light to mental health. When we know to protect ourselves, we become more vocal. We know our rights, we know what is wrong, what is right, and we speak about it, right? Mental health is also about when we speak about the pain that we are going through. A lot of people, a lot of people, whoever is there, I'm sure we all are struggling in one way or the other. But I think the best part is we are showing up, we are we are being strong, we are providing strength to other women. I think, just 2 decades back or 3 decades back, the entire platform here, the entire room here is extremely inspiring. Not only because, it is a room of women, but a room of vocal women, a room of women who have chosen their career, who are doing very good in their careers, right? So I think it's just that we have to pat shoulders on our we have to pat ourselves on the back, that we have come a long way to being vocal. We are again prioritizing our health every single time when we are opening, and when we are seeing reels where women are starting their fitness journey. Let's say at the age of 65, at the age of 75, there is a dadi in India who is doing absolutely incredible at the age of, I think, she's above 80. So I think this is what gives us strength, that if another woman can do, we can do too, right? So I think, yeah, this is something we are prioritizing our protein. We are being vocal. We are saying things. We are saying things what we want, right? Earlier we used to not say. Now I'm really happy if I have to share my own experience. I really like when my mother says, I want this in the breakfast, I want this in lunch. Okay, I don't want this ice cream because she's diabetic. I don't want this ice cream. I would like to have the chocolate ice cream. So I think putting forward what she likes, I think everybody can relate to. Putting forward what we like, our choices, our interests, picking up our own hobbies, I think that is what helps. And mental health is something physical. Mein kya hota hai, when if we are having an injury somewhere or the other, what we can do is, okay, we can see, we can heal it. But what about the person who is suffering mentally? If the person is not speaking up, if the person is a very good actor, we really can't know, right? So I usually, when I counsel people, counsel students primarily, and of course women, I always say that it's very important to have ears to listen to, without being judgmental, without having a single thought that what the person is going through. I think it's very important to give a patient ear, a non-judgmental ear, to somebody who is coming up to us, right? So I think we are short on time. I'll conclude with just saying that we are living in an era where women are just being rock stars. We are speaking for ourselves, and it's absolutely beautiful. Thank you very much.
Much, Dia. It really means a lot. That's what a heartfelt thoughts you have shared with us today. And indeed, we have all been in situations where mental well-being has been so critical to all of us, and we looked at our nearby support system to be able to help us out during those times. So, thank you so much for sharing so much in detail about your journey and how you help others as well. Our next speaker is Usha Adams, also known as Upendra Dasi. Her wellness journey began in 1980 running a health food shop in London and learning deeply about complementary therapies. Since 1977, she has been a teacher of Indian spirituality and has conducted yoga and meditation classes in Sydney and Chennai. Usha ji, we look forward to hearing from you now.
Thank you. Namaste. That was a very interesting panel of people who talked today. And, it's a lot of, I was sitting here, I was thinking about it. I haven't prepared anything, but my journey to wellness started at an age of actually about 20, because my brother had a mental illness, schizophrenia, which was very bad. And I thought, I'm not going to be like that, because we all have mental challenges. So that's when I took up Hatha Yoga. I started practicing from the age of 20. And it really helped a lot. So I want to inspire all of you to take up yoga. I'm associate member of the Australian School of Meditation and Yoga. And everyone there is very, very spiritual. We also do many, Hatha yoga classes all over Australia. So always want to encourage not only just to follow my school, but actually take up this process of yoga. So I believe that diseases can be prevented. So this is what I was involved in at the age of 26, around about 30. We started health food shop where we went on to do complementary therapies. And I, I would advise people. My husband would also advise people on health and wellness, and to actually one of the ways we can prevent disease is by not having too much, stop having all the unhealthy stuff, like try and eat more organic vegetables, have more whole grains, because we are flooded with so many chemicals and additives and all kinds of things. So this can actually prevent some of the major diseases. So I was able to prevent a lot of my becoming mentally well by following yoga and meditation. So I started off with Hatha Yoga, which is really wonderful. It squeezes your glands, it makes you more aware, and your mind is clearer by doing pranayam, and lots of different. It has so many benefits, and I'm sure I could go into each one of those areas. I'm very much inspired the Bhagavad Gita that Lord Krishna speaks about, where he says the mind can be our friend or it can be our enemy. So I'm more interested in like changing people's consciousness, because I really believe that through yoga and meditation, we can change ourselves. We can't do much about other people except to encourage them also to follow this path. If the husband is very bad and there's violence towards women, or we are being harassed, obviously we have to remove ourselves from that particular environment. There's nothing we can do about it. But if it's just, it doesn't talk to you, it's nothing really wrong with that person, but, you can actually change yourself to be more positive and motivated, and you can actually contribute something to this world. I really believe that, like someone was saying, that women are one of the most compassionate, nurturing living beings in this planet. Every mother wants to take care of her husband, her children. She wants to have better mental health. And I feel that meditation and yoga is something that every human being should follow, not just person of Indian origin, but everyone in this world. This is something, because we follow what is, sometimes misunderstood. What is Sanatana Dharma? What it means is you're all living beings, right? We're all the same in front of the Supreme Being. That's basically what it means. And as we are living in this body, the body's like a temple, and we need to keep it as a temple. To go to most of the temples we go to, everything is quite clean, and it's also God-centered. And that's kind of how we need to live in this world. Never to give up, always have courage. When I talk about Bhagavad Gita, it's based on a battlefield. So on the opposing side, there's the enemy. On this side is a good person, and Lord Krishna is talking to that person. So to have courage to get up and fight for what is right, for your rights, right? So this is also part of that. But we can't always be fighting. We also need to be calm and peaceful as well. So this is where yoga and meditation helps you in your interpersonal relationship, in every facet of your living being, of your living in this world. You can actually improve it. There's sometimes, because we are overwhelmed, women do have a position where they can get overwhelmed. Hormonal problems, there could be pregnancy problems, there could be so many things we have to face, right? It's not like, I always say the man just puts the seed, but we are the ones who have to deal with all the challenges that happen as a wife, as a mother. So how do we improve our mental health, and how do we actually show courage? It is through meditation and yoga, and always, coming from a culture that's very spiritual, you do need to fall back on that, fall back onto to God, depending on what tradition you come from. Part of my meditation is I always ask people to chant mantras. This is mantra meditation, is where if you look up Australian School of Meditation, a lot of times we do kirtan, and that is very soothing to the mind. makes us clear. Our mind is consciousness is clear. So these are ways that you can help yourself, and also I emphasize a lot on diet. A healthy vegetarian diet is what I follow. Obviously, everyone in this world won't be attracted to that, but that is like our sages of India have prescribed that to us. So if you can gradually, you know, um, add more vegetables. I was talking to some lady yesterday, and she was saying husband never touches any vegetables at all. He's a very meat centered person, and so those sort of unhealthy ways not so good. So gradually, change, add more uh, salads to your life, add more healthy vegetables, and also protein is very important. All this is also part of yoga. Sometimes people think yoga means just sitting and meditating, right? Closing your eyes. But that's not actually, it's all facet of life, You nourish yourself, you heal yourself, and then you thrive because this is because once you understand how you're not this body and you're also not a subtle mind, you're actually a spiritual being. How do you cultivate yourself spiritually? You know, so this is something very important for each one of you to understand and thrive by becoming a spiritual person, more caring, more compassionate, more loving person. And that is not counted with money or, you know, so so there's lots of things we can do. There isn't much that we can do to the other person or the environment, but there are lots of work you can start doing for yourself. And this is what I want to encourage all women of this world to do, um, to become more and more self-aware. That doesn't mean that you've got to let people walk all over you. There are times when you do need to protest and you do need to walk away from certain situation if there's violence involved or where there is, some abuse is involved. But a lot of the times, you can influence people without, to that those who don't have that extreme of behavior. So this is what yoga and meditation will help you. So with that, our time is short. So let's do a little bit of meditation before I end this. So I will just chant a little bit of Om. If you all want to close your eyes, relax yourself. Always say to yourself, I am a spiritual being, Aham Brahmasmi. This is the mantra I use, Aham Brahmasmi. And you can chant different mantras. Let's do some Oms. Okay, breathe in. Om. Let's do it a few more times. Breathe in. Om. Breathe in. Om. Go within your heart and see you exist. I exist. I am a spiritual being. Aham Brahmasmi. Let all the thoughts go through my mind. Look at your mind and look at your body and understand that you are actually can control the mind and body. You're a spiritual being. We're all spiritual beings. In that sense, we're all one. Thank you very much for joining me. And I hope that I've been able to influence you take up meditation and yoga. Thank you very much.
Wow. What a wonderful journey you have had, Ushaji. And right now, this whole experience that you gave us is really, really very, very spiritual and amazing.
Thank you for giving me this opportunity.
Absolutely a pleasure to hear your thoughts. And we will really hope that this helps our audience to get, change their human consciousness into more positivity and spirituality.
Thank you very much.
And
Thank you.
And our final speaker of today's panel is Sarita Verma, founder of An Element of Fun. She is a health and wellness coach who empowers women to care for every aspect of their lives: supplements, weight management, skincare, mindset, and self love. Her work helps women create possibilities and embrace holistic well being. Sarita ji, we look forward to hearing your thoughts.
No, thank you. Thank you again for that introduction. I really appreciate that uh, that you assisted me to get into the call right now by moving me down the rank. So my name is Sarita Verma. I live now, born in Singapore, but I live here now in Australia. I Health was just an accidental discovery. 7 years ago, I decided I was done with the corporate world after 43 years and looking to do something related to fun. So I started like a travel consultancy, but I realized I didn't even have help. I actually struggled to just get out of bed, and then a girlfriend of mine introduced me to some really good supplements, and and with that, my health just changed. So obviously, we need to eat healthy, but as a working mom, that was very hard. We go to work, we come back, and then we have two little kids. My children are grown up now, but we focus so much on their lives and we forget about us. So I created an element of fun was to create wellness, create fun, and also self love. Because if we don't look after us, then we can't even look after our family. So obviously, we told to eat healthy, but to have 3 healthy meals a day wasn't on my agenda because we're busy. And so I now eat healthy, but I also make sure I have good supplements, not just supplements, but good ones that would enhance the cells in our body to be healthy because of the nutrients in those supplements. It's we need to eat so much of spinach just to get what you call it uh, to get the iron level. So life is about a balance, right? But in all that, it's the most important thing is our gut health. We we if we maintain a healthy gut, we actually solve quite a lot of problems. One is mental health. That's kind of also related to our gut health because we everything centers around the gut health. So obviously, how do we prevent chronic diseases? Our metabolism is also not regulated. We have hormonal balance. Our skin health also suffers just all through the health of our gut. So obviously, we need to make sure that our gut health is healthy, and there are ways to do that. So obviously, we maintaining a healthy gut is also essential for our digestion, our immunity, mental health, and disease prevention. So um, we obviously say eat a balanced meal, and if that's not possible, consider a complementary supplement that would aid certain aspect. Like when I started, I had joint pains. Supplements helped me a lot to fulfill my time because I didn't have time to really have three proper meals. So I looked up. So I created what would work for me. It may not be for everybody because depending on our level of busyness. I'm a grandmother now. I've got two little grandkids, so I spend time with them, um, and and just keeping myself healthy as well. So when we want to keep our guts healthy, we should consider probiotics, good ones, because that uh, would, uh, how do you call it? It would trigger the uh, metabolism of our guts. We and it's also so we get a lot of that in fermented food, right? To eat the probiotics. So there are ways we can keep healthy, and really there's so much research we can also do on Chat GPT. How do I improve my gut health? And it will list some things I could do. eating healthy will help, and it will also impact all the allergies that we have. For those with food intolerance, we need to know what we are intolerant to so that we don't impact our gut, and with that, our health. We can't fulfill a lot of activities that we do. So for me, I while we say we want to eat healthy 3 meals a day, I say that's not possible for me, but then that's not for everybody, because for some people they make a point to cook healthy 3 meals. I do health in a very different way, but it also works. So whatever works for you, but obviously we need to limit our processed food, which I think there's so much awareness now that when I see fried food, even for recipes, when I see that they're frying, I go to the next one, because simplicity is best. Like, naturally, when we consume natural food, that also will give us better health, better gut health. And like I said, it's all related. Definitely, please hydrate. We need to drink 2.5 liters of water. But I also read somewhere you don't just drink water, you need to have a little bit of minerals. So a good pure salt, sea salt, would actually push through some minerals into our bloodstream, and we sleep. Sleep is so important, right? Which we all deprive ourselves. We do, and I'm guilty of that. But I actually am trying. Awareness means we are now trying to include everything that would make us feel healthy, take control of our well-being, and that's it. So for me, life balance works, and I'm very fulfilled. I meet really wonderful people like Shakun, Shireen. Thank you for this opportunity to share my journey of what good health would mean, but to supplement and eating naturally. Because even the food now that we think we eat healthy, unless it's organic, it already has a lot of pesticide. The farmers have over farmed, so the nutrients don't even get into our food before they are plucked and shipped back to us. So the internet is a great source to get a lot of information on how to keep healthy, and that's it. But thank you for the time, and I'm also aware we have we want to finish that soon. So thank you, Shireen, and thank you for all the speakers. I really enjoyed hearing each aspect of what's possible.
Wonderful. Thank you so much, Saritaji. It was indeed wonderful sharing. We all got very benefited out of the very insightful thoughts from your end. And Shefali ji, maybe it's time for you to take over the stage.
Thank you. What should I say? I was just hearing out all the speakers, and it was so much of information that some details I really need to write it, some details I need to practice well, and let's see that how much we can grab it. Definitely, it was an amazing, insightful. So yes, I must say thank you to all our speakers for sharing such valuable insights. Thank you to the audience for joining us with so much of warm and openness. Thank you to the organizers and Miss Shireen, back in team, Mr. Nikhil, our president and vice president, Dr. Anar Mehta, and Achla ji. Thank you so much for bringing this platform for such a knowledgeful and mindful sessions. Today's session has shown us that women's health is multidimensional, and when we nurture every part of ourselves, we thrive. Really, we do. On behalf of Wiki NRI Council, G100 Australia Inspiring Sphere, and Wiki Southern Australia, also Sustainability Foundation, I extend my heartfelt gratitude to everyone who made this event possible. Thank you so much for joining. Before I'll just close this session, I would like to ask Shireen ji if Shireen ji can come and just share some words. Thank you, Shirinji.
Thank you, everyone. And it was really great having you all on a single platform today and talking about women's health, safety, and well being. I would say it was very close to my heart. And I really appreciate you all accepting my invite just on one text. So it means a lot to me that, people still, doesn't want anything answered. They're like, okay, Shireen wants me here and I'm here. So thank you very much. It means a lot to me. Thank you so much once again, every one of you. Achila ji, Anar ji, Ritika, we have missed you on today's session. We hope to see all of you on our next session. And to all my audience, this was just a small trailer what you've seen today. We'll be back with a big showdown in part 2 with all the speakers letting us know more about what they have spoken today and give us more information, which I know would be helpful to each one of you listening us today globally around the world. So we'll be very soon back with you. So keep seeing us, and thank you once again to all the audience, all the speakers, all the dignitaries. We've missed you. Anarji, once again, please be with us. We'll hope to see you very soon. Back to Shakun.
Shireen and all the dignitaries for being with us today. As Shireen ji said, rightly, we missed those who couldn't, and we are looking forward to the part 2 of the Women's Wellness series. This was just a trailer, and we are coming back with some more powerful insights. Until then, nourish, heal, and thrive, and have a great weekend, everyone. Enjoy yourself, rest well, eat well. Take care.